Good morning and welcome, and I am Dr. Peter Holmes, orthopedic surgeon, and I am host of your program, Ask the Doctor. My guest this morning is Dr. Joe Palisota. Dr. Palisota is an anesthesiologist and pain management specialist. If you have any questions for Dr. Palisota in the future, two ways to reach us. Do it through my web to help also people with little insurance. It's www.needfoundation.org or fax 696-9012. Well, I'd like to talk about veteran health care. In my opinion, if you want to see a socialized medicine system in the United States, you go to the Veterans Administration. Basically, if you look at a socialized medicine system, it's any system in which you have a fixed budget. And then its design is to have the bureaucrats within that system figure out how to fit within that budget. Socialized medicine. And in this political year, I'll get a little bit upset to see everybody from all parties trying to figure out how to throw more money into the socialized system, which in my opinion, a large portion of it goes to the bureaucracy to run the socialized health system. Now, in a socialized health system, it could be like when I was in Italy or some of these other countries. Number one, the staff physicians are on salary. Nothing wrong with that per se. But when you're on salary, if you see 10 patients in a day, or if you see 100 patients in a day, you get the same salary. This is what I found in Italy, and this is what I found when I was at the VA in Houston. So what's the rush? In other words, it's sort of like being in line in many situations if you were to go get your driver's license. Next, that's salary. Number two, I think that the VA would shut down if they didn't use many physicians that are in training. Now, not to say that in training is bad, because guess where I trained. But if you have a large part of your medical staff taking care of our veterans who aren't board eligible or board certified, to me that says something. But again, the VA wouldn't exist if they didn't have the physicians that were in training basically running around getting the blood work, doing some of the surgeries, doing the clinics, and the like. Number three, you talk about bureaucracy. I was told to do 2 total joints a week, period. They got paid by the full bed. If I did none, they'd make more money than if I did 2 total joints. Also, if I couldn't guarantee that the second case would be done by 3 o'clock, they wouldn't let me start the second case, which many times was 11 o'clock in the morning. Not to say that this was intentional, but it certainly wasn't pushed or changed. So a lot of times I'd only get 1 case done, where in private practice I'd have 4 or 5 done. Also, a large portion of what should be used for medical benefits is used for housing at the VA. A lot of times I'd do a hip fracture and that patient would be there a month or longer waiting for placement. Now the veteran does need placement, but don't use medical dollars for placement or for housing. It takes away from the care of the veteran. The solution, if I had my way, the VA would be shut down and used entirely for housing of our veterans that need it. But give the veterans a card, a Medicare card at least. Let them go to the doctor the next day if they want to. Let them see the specialist the next day if they want to. Let them get scheduled for surgery the next week if they want to. Sound expensive? Perhaps at first, because a lot would get done. But I think the results would be better, much more efficient, and less bureaucracy. These are my opinions. If you have any comments, there's 2 ways to reach me. Do it through my web, www.needfoundation.org, or fax 696-9012 to ask the doctor.
Hi, I'm Danielle. I injured my knee back in February, but thanks to the foundation, I'll be playing again.
I'm Dr. Peter Holmes. The Orthopedic Need Foundation was formed to help those families who are underinsured or uninsured return their athlete to their sport. Please help us to return kids back to their sport after injuries like this.
You can send your donations online at www.needfoundations.org or call 210-542-1722. All donations are tax deductible. Make a difference in a child's life.